Hello everyone, welcome to the Virtual Student Health Fair. This is Ting Li. I'm a PhD candidate from Dr. Dan Burgess' lab at the Department of Pharmaceutical Science. So today I would like to give a presentation about part of the work that I've been done here at UConn for my thesis. The title of my presentation is a mucoadhesive in situ forming gel for oral mucositis pain control. Oral mucositis is a very common complication of chemotherapy or radiation therapy during cancer treatment in clinical. And the current first-line therapy to maintain the oral mucositis pain control is an oral rinse containing anesthetic drug inside. However, there are some drawbacks related to this types of dosage form. First is that they doesn't last long in the oral cavity, so they result in a very short duration of pain relief. And second is that when patients use these anesthetic oral rinse, they're basically rinsing their whole oral cavity, resulting in numbing of healthy oral mucosa at the same time. Therefore, to overcome these drawbacks, I have designed and developed this novel dosage form, mucoadhesive in situ forming gel. So basically, it is a mucoadhesive dosage form, so it sticks on the oral mucosa surface and to prevent the spreading of the whole oral cavity. And secondly is that it is an in situ forming gel formulation, indicating that the formulation is a liquid at room temperature and it forms a solid gel at body temperature, further preventing the formulation from spreading all over the oral cavity. So that's a background and the design of this dosage form. In next slide, I'm going to talk about the work that have been done with this formulation. So first of all, to develop this formulation, we need to do some efforts towards the excipient selection as well as excipient concentration determination. So the first step is we looked at the main excipient for the in situ forming properties. So here I used the pluronic F127 and F68. So the figure on the top left gives us the result of gelation temperature at different combinations and concentrations of F127 and F68. From the result, we can tell that the F127 reduced the gelation temperature, whereas F68 increased the gelation temperature. By taking advantage of the properties of these two polymers, we're able to manipulate the formulation to result in a final gelation temperature below body temperature but higher than room temperature. So another important work we need to do is to select an appropriate mucoadhesive excipient. So here I did a mucoadhesive evaluation study. It is a study that requires the use of an instrument of a texture analyzer. And the way how the experiment is run is shown in the picture, the small picture here. So on the top, the pinkish area is an animal tissue, animal buccal mucosa. And on the bottom is the formulation gel and with the temperature maintained at 37 degrees C by a heating plate. So the formulation gel and the mucosa tissue will be contacted with each other, and then they will be detached from each other. The detaching force versus distance or versus time will be recorded, and the area under the curve can be used to evaluate the mucoadhesive potential. So we used this method to do the mucoadhesive potential evaluation, and this is a result to show how different mucoadhesive excipients can improve the mucoadhesive property of the formulation. So in this second figure, the pluronic group is a control group that contains only pluronic F127 and the F68. And from 974P to AA-1 group, those are the formulations containing not only the pluronic, but also one type of mucoadhesive excipient. So from the result, we can see that once the mucoadhesive excipient was incorporated in the formulation, the mucoadhesive strength was significantly improved compared with a pluronic only formulation. And among these three mucoadhesive adhesive excipients, I mean 974P, 971P, and AA-1. So this among these three excipients, 974P showed the best mucoadhesive potential, and therefore it was used in our formulation to achieve a mucoadhesive property. So here's a picture show how is the formulation looking like. So it has an orange color, which comes from the bupirocaine salt of gamma linoleate. And the formulation is a liquid at room temperature, and it forms a solid gel at body temperature, 37 degrees C. So what happens inside the formulation during this temperature range? At a room temperature of 25 degrees C, the pluronics form micelles in the system, and these micelles are randomly distributed and they're mostly free-flowing. So making the formulation also free-flowing. However, when temperature slowly increased, the more and more pluronic micelles are generated in the system, and at the gelation temperature, there are so many micelles in the system that they closely packed with each other to form a solid gel. So that's the mechanism of the in situ forming gel formation. And furthermore, once we have a formulation, we need to characterize their physical chemical properties. I show two results here, but of course, there are many other physical chemical properties that are very important for this type of dosage form. And you can refer to the reference attached here for more details. But for these two physical chemical characterization, the left one showed a result coming from the instrument called the polarized light microscope. This instrument can tell whether there are crystalline structure in the observed material. So on the left panel with a dark blue background is a drug molecule, bupirocaine gamma linoleate. We can see the drug molecule has crystalline structure in nature. And the second picture is a picture with a purplish background. It's a picture coming from a formulation. And compared with the drug picture, we can see there was no crystalline formed in the formulation. This two picture combined together can tell us that the drug molecules are dissolved or incorporated inside the micellar core in the formulation. In another word, the drug molecules are not suspended in the formulation. So, and the figure here with G prime and G double prime is a result of a rheological characterization. G prime here is a storage modulus, which indicates how solid your material is. And the G double prime here is called loss modulus and indicating the liquid properties of an observed material. And the absolute value of this both storage modulus and a loss modulus together, indicating the overall mechanical strength of a formulation. So as we can see, the both storage modulus and the loss modulus increased when temperature goes up, indicating the formulation gets thicker and thicker in nature along temperature. And the comparison between storage modulus and loss modulus, we can see at low temperature about 15 to 22 degrees C, the loss modulus was higher than the storage modulus, indicating the liquid property of the material or of the formulation is dominating compared to the solid properties. As temperature goes up, the storage modulus slowly overwhelmed the loss modulus, indicating the formulation gets thicker and thicker. And at a temperature about 35 degrees C, we can see the storage modulus and the loss modulus stopped growing and they reached a plateau. Therefore, at the temperature right before the plateau indicates a successful formation of the gel. In another word, that temperature was the gelation temperature. So that these are two physical chemical properties of this formulation. And again, you can refer to this publication for more details of formulation characterization. So now I would like to tell another story with related to this formulation. It's drug loading enhancement. So we know for oral delivery, we always want a higher drug loading, especially for this purpose. The reason for that is the higher the drug loading, the smaller the dosing volume and the less the spreading in the whole oral cavity. Therefore, we want to have a desirable drug loading of about 10 mg per ml. However, our initial or our primary formulation when we made this type of formulation was 6.5 mg per ml, and there was roughly about 3.5 mg per ml gap between our primary formulation and our desired formulation. So in order to enhance the drug loading in the formulation, I did the drug solubilizing experiment by two different strategies. First strategy to enhance the drug solubility in the system is to use a cosolvent system. So I tried two cosolvent here. And just to clarify, this is a cosolvent system. Both of them are cosolvent system with water. So I tried two different cosolvent here. First is PEG 400 and second is ethanol. As we can see, PEG 400 had a solubilizing effect towards the drug molecule bupivacaine gamma linoleuate, and the maximum enhancement was about 2 times. However, ethanol did not have any solubilizing effect towards this drug molecule in this specific dosage form. And on the right, the top right is a table showing another strategy using of a solubilizer. So to solubilize a drug molecule, besides cosolvent system, we can always use a solubilizer in the system. So I tried different solubilizers, which were largely reported in the literature, or some of them were already used in the FDA-approved drug products. So I tried different solubilizers and I compared the drug solubility in different solubilizer solutions and found out that the sodium lauryl sulfate showed the most significant solubilizing effect towards bupivacaine gamma linoleuate. Therefore, sodium lauryl sulfate was used in the formulation to improve the drug loading. So in the bottom form, where I shortened the sodium lauryl sulfate to SLS, showed the results of drug loading before and after drug loading enhancement. So our primary formulation was CP167, and it had a drug loading of about 6.5 mg per ml. And the improved drug loading formulation was SCP-167, and the drug loading was above 10 mg per ml, which was around the 10.7 mg per ml. So a conclusion of this result is that by using the sodium lauryl sulfate, we were able to improve the drug loading to our desirable drug loading level. So I draw a picture here to indicate that once the SLS was incorporated in the system as a solubilizer, there will be not only pluronic micelles in the system, but also SLS micelles in the system. This is because the reason for SLS to solubilizing bupivacaine gamma linoleuate is to form SLS micelles. So that's some work I've also published recently in 2021, and you can search it online. So last but not least, I'd like to show my appreciation to many people. First is my advisor, Dr. Diane Burgess. She's a very great mentor, and she helps me a lot in not only my scientific research, but also my personal life. And also our collaborator, Dr. Rajesh Lala, who is a dentist at UConn Health Center and who helps a lot in this project. And I would also like to thank the whole Burgess Lab members, previous lab members, current lab members. And I also like to thank my family and friends who give me unconditional support throughout my PhD study. And also, this research cannot be completed without the support of different grant sources. First is UConn Spark Technology Commercialization Fund, and second is the International Association for Dental Research Innovation in Oral Care Award. So with that, I'd like to finish my today's presentation.